My name is McClain, and today I'm here with Mrs. JT for my health assessment video for Maryville University. I have asked her to empty her bladder and placed on this gown. I've obtained her vital signs, which included her heart rate, her respiration, her temperature, her blood pressure, and her pulse oximetry. Now I'm going to start with her assessment. I'm looking at her head, her skull, to ensure that it looks all normal without any abnormalities in shape, size, lesions. I am looking to make sure her eyes are set normal on her face and they're symmetrical. I'm looking at her ears to make sure that her ears are placed on her face in a normal place also and that they're symmetrical. And I'm looking at her hair. Her hair is evenly distributed and it looks good. No signs of any alopecia or anything that's abnormal. Now I'm going to palpate her skull. I'm going to palpate her frontal sinuses. Do you have any pain there?
No.
Her maxillary sinuses. Do you have any pain there?
No.
And I'm going to test her temporomandibular joint. No grinding or clicking noted. Do you have any pain there?
No.
Okay. I am now going to ask her some orientation questions. Can you please tell me who the President is of the United States?
Barack Obama.
And the state in which we reside?
Florida.
And what year is it?
2015.
Great. She's alert and oriented times 3 to person, place, and time. Now I'm going to start by looking at her face, her structures. I'm going to look at her eyelids for any lesions or abnormal masses. Her eyelashes are evenly distributed. I'm looking at her sclera and everything looks good. Her pupils look good. There's no redness or anything there. I'm going to test her lacrimal apparatus. Do you have any pain there?
No.
Okay, great. I'm going to do the cover on cover test to test for strabismus. Can you please look straight forward? Good. And no strabismus noted. Now I'm going to move on to her earlobes and look for that. I do not see any lesions or masses on her earlobes. They look great. And I'm going to look inside of her ears. Her tympanic membrane's nice and gray and her landmarks are easily found without any abnormalities or redness. Same thing on this ear. Pearly gray without anything that's worrisome. I am going to now move on to her mouth. Her lips look nice and moist. I'm going to look inside. Her teeth look good. No signs of dental caries. Inside her cheeks look good. And I'm going to look inside with a light to ensure there's nothing going on in there that's concerning. Okay, good. Go ahead and stick your tongue out. Okay, to the side, and to the other side, and up. Great, and I don't see any masses or lesions. She has no malodor to her mouth. Everything looks good. Her adenoids, her anterior and posterior pilars look good. Her adenoids and tonsils look good. Her uvula was midline. I'm now going to go on to her cranial nerves. Cranial nerve number 1 is the olfactory nerve. I'm going to ask her to please close her eyes and occlude her left nares. And I'm going to place something under her nose, and she's going to tell me what she smells.
Coffee.
Great. Now we're going to do, if you can occlude the right nares, and tell me what you smell.
Orange.
Great job. Okay, now we're going to do cranial nerve number 2, which is the optic nerve. That's going to test her peripheral vision. Can you please tell me whenever you see my fingers come in? Great.
No.
Great.
No. No.
Great.
No.
Great. Great. And I'm going to look in her eyes to make sure she's got light reflex, which she does. Now we're going to move on to cranial nerve number 3, 4, and 6, the ocular motor, the trochlear, and the abducen. That also deals with vision. We would typically do a visual test at this time, which could use the Snellen chart, which is similar to this, and we would do a near vision test. I'm also going to have her Keep her head straight forward to me. Look at the pencil, and we're going to go through the 6 cardinal gazes. Okay, ready? Great job. That's intact, and I'm going to look to ensure that her pupils are equal and reactive. And they are. They go from 3 millimeters to about 2 millimeters, which is a normal finding. Now we're going to move on to cranial nerve number 5, which is the trigeminal nerve. I'm going to test her on her face to make sure that she has aware of soft sensation and hard sensation. I'm going to do it on various parts of her face. She's going to tell me where I am touching and if it's hard or soft. Okay, close your eyes. Thank you.
Forehead soft. Left cheek hard. Right cheek soft. Chin hard.
Great. She did a good job. Now I'm going to test her tone in her face. Can you please clench your jaw? Great job. She has good facial tone. Now we're going to move on to cranial nerve number 7, and that's her facial nerve. I'm going to do various things I'm going to ask her to perform, and she's going to follow my command. Can you raise your eyebrows? Can you shut your eyes very tight? Good job. Can you smile? Can you frown? Can you purse your lips out and whistle? Okay, can you puff up your cheeks? Okie dokie. Great job. Now we're going to move on to cranial nerve number 8, and that's her acoustic nerve. That nerve tests both her hearing and balance. So I'm going to take, first I'm going to do the whisper test. I'm going to have her cover her right ear, and I'm going to whisper either 3 numbers or 3 letters, and can you please repeat them?
A, B, C.
Great. Now we're going to do the other ear.
1, 2, 3.
Great job. She's passed that. Now we're going to do the Weber test, in which I'm going to place this on her skull right here, and she's going to tell me if she hears it better in her right ear, left ear, or both equal in her ears.
Equal.
Great job. Now we're going to do the Rhining test, and that's going to test for air conduction and bone conduction. And I'm going to tap this, place it on her mastoid bone, and then remove it and place it near her ear about a ½ an inch to an inch away. And that's going to tell us how her hearing is for air and bone conduction.
No. Great.
Let me know when it's done.
No.
Great. And her air conduction is about 2 times her bone conduction, and that's a normal finding. Now I'm going to ask you to step down, and we're going to see if your gait, your balance. Are you able to close your eyes, please, and then take 1 step and place it in front of the other, 1 foot. There you go. Continue. Good job. And now let's return to the table. Okay. Okay. Now we're testing cranial nerve number 9. That's the hypoglossal nerve, or excuse me, glossopharyngeal nerve. I'm going to give you some things to taste, and you're going to tell me whether they're sour or sweet. Will you please close your eyes and stick your tongue out?
Sour.
Great. And now we're going to do another thing.
Sweet.
Great. Okay, that was intact. Now we're going to do cranial nerve number 10, which is the vagus nerve, and that's going to test her gag reflex. Go ahead and open up. Okay, and that worked. Cranial nerve number 11 is a spinal accessory nerve, and I'm going to test her strength. I'm going to place my hands on her shoulders and ask her to raise them up, and then place your head, there we go, and there we go. Okay, and lift your head up and down, okay, and left and right. Great. She has great spinal accessory nerve. Now we're going to do cranial nerve number 12, and that's her hypoglossal nerve. I'm going to ask her to stick her tongue out. We're going to assure that it's midline, and then I'm going to have you place it in your cheek. Great. That nerve's intact. Now we're going to move on to her neck, and I'm going to look to assess and make sure her trachea is midline and that her thyroid does not appear to have any masses or nodules. And it does not. Her trachea does appear midline. and her thyroid does not appear large. I do not see any jugular vein distension. I don't see any heaves or bruise in her neck that are concerning. Now I'm going to palpate and ensure that it's midline, and which it is. Can you please tilt your head forward and swallow for me? Great, and her thyroid feels normal. Now I'm going to palpate her carotid, one at a time. And now I'm going to palpate her lymph nodes. I'm going to start with the preauricle, and then the postauricle, and the occipital, and then the submental, and the submandibular, and the tonsillar, and then the superficial anterior cervical chain, and the superficial posterior cervical chain, and then the deep cervical chain. And then I'm going to palpate the supraclavicular. And I have not found, they do not feel enlarged or swollen at all. They feel normal. Now I'm going to listen to her carotid and her thyroid. Can you hold your breath, please? Okay, you can breathe. Okay, that was normal. No bruise noted or anything like that. Okay, now I am going to go to her back and inspect her back. I'm going to turn. Let's see. I'm going to first inspect her thoracic cavity to make sure that there's no masses, bulges, or anything that's abnormal that would make me think that she has something going on that needed further testing. I'm going to ask her to bend straight forward with her neck down to inspect for any sign of scoliosis, which I don't see anything. There's no abnormal lesions or masses or any moles that are concerning on her back. If I did, I would get those tested. You may lean up a little bit now. Okay, now I'm going to percuss her back to make sure that it sounds good and nothing abnormal. You let me know if you have any pain.
No.
No pain. We wanted to make sure the costal vertebral angle had no pain because that would be a sign of something going on with her kidneys. I am going to palpate for expansion. Go ahead and take a deep breath in. Great. And now I'm going to palpate for tactile firmness. Please say 99.
99.
Good. There was no abnormal finding with that. That looks good. I am going to now palpate for diaphragmatic excursion. Can you please hold your breath? Okay. I'm going to mark on her back where the finding is. Go ahead and take a breath and then hold it again. Okay, great. And then I'm going to mark that. Now, if you will take a deep breath and exhale as much as you possibly can. Great. Okay. Okay, I'm going to mark that. Now I'm going to measure, and a normal finding is between 2 and 5 centimeters, in which she is right at about 4 centimeters, which is a normal finding. Great. Now I am going to listen to her lung sounds. Take a deep breath in. Good job. Go ahead and raise your arms for me. Good job. If you'll keep them up, I'm going to percuss your lateral side. Tell me if you have any pain.
No.
Okay, no pain noted. You can go ahead and rest your arms down. Now I'm going to look at her abdomen for any deformations or any masses or bruise or any heaves, which I don't notice. Okay, and I'm going to have her, actually I'm going to look at her upper body now, look at her arms and make sure I don't see anything here. No abnormal things that are concerning on her shoulders, on her arms. Her turgor, let me check that. is within normal limits, and her capillary refill is less than 2 seconds, which is a normal finding. I'm going to palpate her radial pulse, and then palpate her brachial pulse, which both were normal. I'm going to now inspect her chest and see if I see anything abnormal that's concerning. No, nothing. I'm going to percuss her chest. Any pain? No. Okay, now I'm going to have her lay down. I'm once again going to inspect her abdomen. Can you take a deep breath in and hold it? Good. There's no masses or bulges or anything that's concerning for anything there. Go ahead and breathe. As far as like a hernia or any such of the sort, I'm going to now auscultate. I'm going to auscultate her lungs first. Take a deep breath. Now I'm going to auscultate her heart. Her aortic valve and her pulmonic valve. Erb's point. Tricuspid valve. And her mitral valve. I'm going to auscultate her abdomen. In all 4 quadrants. She has normal active bowel sounds. Now I'm going to auscultate her aortic valve. Her right renal artery. And her left renal artery. Her right iliac artery. Her left iliac artery. And her right femoral artery, and her left femoral artery. No bruits or heaves or anything of concern. I am going to now do tactile fremitus on her. Go ahead and say 99.
99.
Good. And I don't feel anything abnormal. I'm going to now place my hand on her point of maximal impulse, her left sternal border, the base of her heart, and then I'm going to palpate for her aortic artery. All normal finding. I'm going to go back to the point of maximal impulse, and I'm going to have you turn your head to the side, and I'm going to compare it to her carotid pulse. And they are synchronous, which is a normal finding. Now I'm going to palpate. You can centralize your head if you'd like. Now I'm going to palpate her abdomen. I'm going to first palpate, percuss to see the liver borders. Good. Okay, good. Her liver's within normal range right there. Now I'm going to percuss her spleen. Good job. Now I'm going to try and palpate her liver. Can you take a deep breath in? And let it out. Okay. Deep breath in. And let it out. Now her spleen. Deep breath in. And let it out. Now her left kidney. And deep breath in. And let it out. Now her right kidney. And everything felt normal, within normal size. No problems as far as that. Now I'm going to palpate her abdomen. First I'm going to do superficial, light palpation. Any pain? No. And deep palpation. Any pain with that? No. Okay, great. Okay. Now I'm going to have her sit up. And turn and face me, please. I'm going to look at her legs for anything abnormal. I'm looking at her hair on her legs or any discoloration, for veins, cords, any sign of redness or swelling or edema. Her skin is nice and warm. and it looks good. Her skin, she's got a little bit of spider veins, which is normal because she's had children and she's a nurse. I'm going to palpate her popliteal pulse, her tibial pulse, and her pedal pulse. They're all 2+, and that's normal. I'm going to now do her reflexes of her patellar. There we go. Okay. And then I'm going to do her Achilles pulse. Her Achilles tendon and her brachial. Great. Everything was within normal reason. And I think that concludes our video. Thank you very much.